In order to diagnose clinically a melanoma, we have to wait a little bit that the lesion become large enough to have had time to develop the classic ABCD criteria, namely asymmetry, border irregularity, and color variegation. The great news is that using dermoscopy, we are able to anticipate the diagnosis as compared to the clinical examination, because dermoscopy can show very early criteria even in the context of small size melanoma. But now the question is, what are the most important criteria we can visualize in early melanoma using dermoscopy? Well, it was Peter Sawyer who first recognized at the time of the consensus net meeting that there are at least three criteria which are the most common ones in early melanoma. And here we can see clearly the three criteria we are referring to, and they are asymmetry of color and structure, the presence of an atypical pigment network, and presence of blue-white color. In a subsequent study performed on the internet, we verified that the sensitivity of the three-point checklist is quite high. More than 90% of melanomas and BCCs are correctly identified using this technique, and this value is independent from the expertise of the observer. In contrast, the specificity overall was about 70%, but it was significantly influenced by the profession of the observer, with dermatologists performing best. In a subsequent study, we verified that even in the hands of general practitioners who have no experience in dermoscopy at all, by doing a short course of 1 day, they increased dramatically their ability to triage lesions suggestive of skin cancer. What are the three criteria in the list of the 3 point? Well, they are asymmetry of color structures, atypical network, blue-white structures, and the lesion should be considered suspicious if more than 1 point, one of these criteria is present. This is an example of melanoma showing clearly an asymmetric distribution of color and structures. We don't care too much about the shape of the lesion when evaluating the dermoscopic criteria. Also here, an example of melanoma showing asymmetry of color and structures. And here, an example of a nevus showing a little bit of asymmetry of shape, but we don't care about this. The only thing is the distribution of colors and structures. And in this case of nevus, this distribution is quite regular. This is an example of melanoma in situ showing clear-cut atypical pigment network. The definition we use is more than one type of network in the same lesion means that this could be an atypical network. And here we can easily see that we have a prominent dark brown network on the left side and a delicate light brown network on the right side. Here, another example of a melanoma showing clear-cut atypical network represented by more than one type of network, more prominent on the right and more delicate on the left. Here, a classic example of a black nevus showing regular network. One type of network means nevus network. Concerning the third criterion, this is called blue-white structures. Blue-white structures of any type. It means that whatever blue color and white color in the lesion is found, then the score is 1 point. Here, another example of melanoma showing predominantly white color, and the white should be whiter than the surrounding skin. Here, a classic example of a more thick melanoma showing asymmetry of colony structures and especially blue color. There is no evidence of network in this case. And here, an example of a lesion which is definitely asymmetric in color and structures, and also definitely showing blue-white coloration. In this case, the lesion should be considered suspicious, but this was not melanoma, but it was BCC. So this rule is really useful also for the diagnosis of pigmented basal cell carcinoma.